We are living through a paradox. We have mapped the human genome, split the atom, and connected the entire planet through silicon chips. Yet, when it comes to the fundamental biology of our own bodies, we are told that decline, decay, and decrepitude are inevitable. We are told that living to 120 or 150 years in perfect health is science fiction, a fantasy reserved for movies and novels. But what if I told you the science is already here? In the last 30 years, in quiet university basements and underfunded biotech startups, researchers have discovered the biological switches that control aging. They have reversed blindness in mice, restored the hearts of elderly primates, and reset the cellular clocks of human tissue. The technology to extend human health span by decades exists right now. It is not theoretical. It is proven in the lab. So, why aren't you taking these medicines? Why isn't your doctor prescribing them? Why are we still suffering from the same degenerative diseases that plagued our ancestors? The answer lies in the cold, hard calculus of the global economy. The modern medical industry is not built on health. It is built on the management of chronic disease. A patient cured of heart disease at 50 is a customer lost for 30 years. But a patient maintained on statins, blood thinners, and beta blockers until they are 85. That is a revenue stream worth hundreds of thousands of dollars. Aging is the most profitable disease on Earth. It is the foundation of the pharmaceutical giants, the insurance conglomerates, and the hospital networks. To cure aging is to bankrupt the most powerful industries in human history. Today, we are going to expose 10 revolutionary life extension technologies that were proven, viable, and then systematically buried. We will look at the science they don't want you to see, and the brutal tactics used to make sure these cures never reach your medicine cabinet. If you believe that your health should not be sacrificed for their quarterly profits, hit that subscribe button right now. Join us as we excavate the forbidden history of medicine and turn on notifications, because the information in this video is the kind that powerful people pay millions to keep quiet. 1. The telomere extension enzyme. To understand the first suppressed technology, you must understand the fundamental clock ticking inside your cells. Inside almost every cell in your body, your DNA is packed into chromosomes. At the tips of these chromosomes are protective caps called telomeres. Think of them like the plastic aglets at the end of a shoelace. Every time your cells divide to repair skin, grow muscle, or replace blood, these telomeres get shorter. When they become too short, the genetic shoelace phrase, the cell stops dividing. It becomes senile, or it dies. This is the Hayflick limit, the barrier that supposedly guarantees we die. In the late 1990s, a breakthrough occurred that should have changed human history. Researchers isolated an enzyme called telomerase, which creates these protective caps. But more importantly, they developed a synthetic activator, a compound that could turn this enzyme back on in adult cells, effectively refilling the hourglass of life. In a landmark series of animal trials, elderly mice, equivalent to 80-year-old humans, were treated with this activator. The results were not just improvements, they were reversals. The gray fur turned black and glossy. Their shrunken brains regained mass and cognitive speed. Atrophied muscles bulked up. The mice didn't just look younger. Biologically, they became younger. The Hayflick limit had been bypassed. But when the pharmaceutical industry looked at this data, they didn't see a miracle. They saw an apocalypse. Short telomeres are the root cause of the diseases of aging, cardiovascular collapse, immune system failure, and general frailty. If you prevent telomere shortening, you eliminate the market for thousands of drugs designed to treat the symptoms of aging. You don't need blood pressure meds, osteoporosis treatments, or dementia care if the cells remain young. The industry couldn't deny the science, so they weaponized fear. A narrative was constructed and pushed through industry-funded journals, linking telomerase activation to uncontrolled cell growth, or cancer. While the initial studies showed no increase in cancer risk, because young immune systems fight cancer better, the seeds of doubt were planted. The massive biotech firm holding the patents was quietly acquired by a pharma conglomerate. The division was defunded. The lead scientists were reassigned to benign projects like skin cream, and the systemic telomere activator was buried under a permanent safety review that has lasted for 20 years. 2. The senolytic nanobot swarm. As we age, not all cells die. Some enter a state called senescence. These are zombie cells. They stop working, but they refuse to perish. Worse, they secrete a toxic sludge of inflammatory chemicals called the SISP. This toxic sludge spreads to neighboring healthy cells, turning them into zombies too. It's exactly like one rotten apple spoiling the entire barrel. This accumulation is why 70-year-olds have chronic inflammation, arthritis, and aches that never go away. A team of bioengineers and immunologists developed a solution that sounded like science fiction but was purely biological: senolytics. But they went further, designing microscopic, lipid-based nanobots. These were programmable biological delivery vehicles coded to hunt down the specific protein signature of a zombie cell, latch onto it, and inject a payload that forced the cell to undergo apoptosis, programmed suicide. When injected into aged mammals, these nanobots scrubbed the body clean. Within weeks, markers of systemic inflammation dropped by 70%. Kidney function was restored. Fur density returned. The animals lived 40% longer, but more importantly, they were active and healthy until the very end. It was a functional cure for frailty. However, chronic inflammation is the single biggest driver of pharmaceutical revenue. It is the reason people take painkillers, steroids, statins, and autoimmune suppressants for decades. A therapy that clears the source of inflammation, the zombie cells, once or twice a year would decimate the market for daily maintenance drugs. The suppression here was bureaucratic genius. The FDA and other regulatory bodies, heavily influenced by industry lobbyists, do not classify aging as a disease. Therefore, you cannot run a clinical trial to treat aging. You can only treat a specific disease. The developers of the nanobots were forced into a regulatory trap. They had to prove their therapy cured a specific condition, like knee osteoarthritis, in isolation. This made the trials prohibitively expensive and narrow. When the funding rounds came, the big players stepped back, citing regulatory uncertainty. The technology sits in limbo, too effective to be ignored, but too disruptive to be funded. 3. The Methuselah gene therapy protocol. Your DNA is under constant assault. UV radiation, pollution, and normal metabolism break your genetic code thousands of times a day. Your body has repair crews, proteins that fix these breaks. But as you age, these repair crews get sloppy. They miss spots. They make mistakes. These mistakes accumulate into mutations, eventually leading to cancer and tissue failure. This technology utilized CRISPR-Cas9, the gene editing tool, but in a way that had never been applied before. Instead of editing a specific gene, scientists engineered a gene therapy protocol that inserted extra copies of the genes responsible for DNA repair, specifically the CYART6 and PRP1 genes. Think of it as hiring 10 times more construction workers to maintain a building. The Methuselah protocol was tested on cells taken from centenarians, people who lived to 100. It turned out these superagers naturally had better repair mechanisms. This therapy gave that superpower to ordinary organisms. In trials, cells treated with this protocol became virtually impervious to radiation and oxidative stress. They repaired damage instantly. Cancer rates in treated subjects dropped to near zero because mutations were fixed before they could become tumors. The oncology market is valued at over $200 billion annually. It is driven by chemotherapy, irradiation, and immunotherapy, treatments that are administered over months or years. A preventative gene therapy, administered once in midlife, that drastically reduces the probability of cancer ever forming, is a financial nightmare for the oncology industrial complex. The suppression was ethical and legal. A massive lobbying effort was launched to ban germline editing and enhancement therapies. While this protocol was for adults and not embryos, the lines were deliberately blurred in the media. Designer babies became the scare tactic. Amidst the manufactured moral panic, grant funding for preventative gene enhancement was frozen. The research institutes were threatened with the loss of government contracts if they pursued human enhancement rather than disease treatment. The protocol was archived, deemed ethically premature. 4. The NAD plus infinity loop. Every cell in your body runs on a battery called the mitochondria. The fuel for that battery is a molecule called NAD plus. When you are 20, you are swimming in NAD plus. You have boundless energy, you heal fast, you sleep well. By the time you are 50, your NAD plus levels have dropped by half. By 80, they are critically low. The mitochondria begin to sputter and fail. The lights go dim. This is metabolic aging. You can buy NAD supplements today, but they are inefficient. Most of it is destroyed by the liver. The suppressed technology was a biosynthetic loop. Scientists discovered a precursor molecule combined with a specific enzyme inhibitor that didn't just top up the tank, it fixed the leak. It retrained the body's salvage pathway to recycle NAD plus with 99% efficiency, effectively restoring the metabolic profile of a teenager permanently. In metabolic studies, old subjects treated with the infinity loop compound saw their insulin sensitivity return to normal. They burned fat like young animals. Their endurance on treadmills doubled. It was essentially a cure for metabolic syndrome and type 2 diabetes, achieved without dietary changes. The diabetes and metabolic disorder market is the crown jewel of the pharmaceutical industry. Insulin, metformin, and the new weight loss injectables represent trillions in future revenue. A compound that restores the body's natural ability to regulate sugar and energy would wipe out the sector. The loop compound was never patented because it was based on naturally occurring biology. This meant Pharma couldn't own it exclusively. So, they destroyed it. A flood of conflicting, low-quality studies was funded and rushed into publication, claiming that high NAD plus levels fueled tumors, a claim debunked by the fact that young people have high NAD plus and low cancer rates. The confusing data spooked investors. Simultaneously, the FDA moved to reclassify key NAD precursors as drugs rather than supplements, locking them behind prescription walls and halting over-the-counter innovation. 5. Bioelectric organ regeneration. We tend to think of the body as a chemical machine, controlled by hormones and proteins. But fundamentally, we are electrical. The blueprint for your body plan, where your arm goes, how big your liver is stored in bioelectric fields. Developmental biologists, led by pioneers at major universities, cracked this code. They learned to speak the electrical language of cells. They developed a biodome, a wearable cuff that could be placed over a stump or a damaged organ. This cuff didn't deliver drugs. It delivered a complex, patterned ion current that mimicked the signals found in the womb. It told the cells, build a leg here or regenerate the kidney tissue. In amphibian models, which usually cannot regrow limbs, the biodome stimulated the complete regeneration of a severed leg, including bone, muscle, nerve, and skin. In mammalian tests, it triggered the regeneration of damaged liver tissue without scarring. It offered a future where amputation and organ failure were temporary setbacks, not life sentences. The organ transplant industry is a logistical empire involving surgery, transport, and critical care. But the real money is in immunosuppressants. A transplant recipient must take expensive anti-rejection drugs every day for the rest of their life. If you can regrow your own kidney, there is no rejection. There are no drugs. The research was systematically marginalized as fringe science. Despite reproducible results, major medical journals refused to publish the papers, citing unclear mechanisms. The grant committees, staffed by traditional molecular biologists, defunded the bioelectric labs in favor of stem cell research, which is far more expensive and difficult to commercialize. The technology remains stuck in the basic research phase, starved of the clinical trial funding needed to reach human patients. 6. The mitochondrial uncoupling agent obesity is often framed as a failure of willpower, but biologically, it is a failure of energy regulation. In the 1930s, a chemical called DNP showed that you could chemically force mitochondria to burn energy as heat rather than storing it as fat. It worked, but it was dangerous and unstable. 80 years later, modern chemists solved the safety problem. They created a soft uncoupling agent, a molecule that possessed a self-limiting mechanism. It would slightly raise the body's basal metabolic rate, burning off excess calories as mild, imperceptible body heat, but would shut off automatically if the body temperature rose by more than 0.5 degrees. It was a perfect, safe, fat-burning switch. In trials with morbidly obese mammals fed a high-sugar diet, the agent completely prevented weight gain. Existing fat stores melted away within weeks. The liver cleared itself of fatty deposits. Insulin resistance vanished. It was the functional cure for the global obesity epidemic. The implications of curing obesity are staggering. It impacts the food industry, the diet industry, gym chains, and the pharmaceutical sectors treating hypertension, heart disease, joint pain, psychan, and diabetes. A pill that fixes obesity without effort attacks the foundation of the modern consumer economy. The suppression was regulatory. The FDA, burned by the history of diet pills, set the safety bar impossibly high. They demanded 20-year longitudinal safety data before the drug could be approved for the general public, a standard that takes decades and billions of dollars to meet. No venture capitalist would wait that long. The patent was bought by a holding company and sits in a vault, while the industry pushes monthly injectable subscriptions that must be taken forever to maintain weight loss. 7. Project Cronus, young blood filtration. For centuries, folklore spoke of vampires feeding on the young. Science has found a disturbing grain of truth in this. Experiments in parabiosis, stitching the circulatory systems of an old and young mouse together, prove that young blood rejuvenates old organs. But the suppressed technology wasn't about harvesting blood from the young. It was about cleaning the blood of the old. Scientists identified specific pro-aging factors, like the protein CCL11, that accumulate in our blood as we age. These factors inhibit stem cells and slow down repair. A medical engineering firm developed a sophisticated plasmapheresis machine, a blood washing device. It filtered a patient's blood, selectively removing these toxic aging proteins while leaving the healthy cells intact, and concentrating the body's own rejuvenating factors. Human pilots were conducted in secret. Elderly patients with early-stage dementia and muscle wasting underwent the filtration. The results were immediate. The brain fog lifted. Inflammation markers plummeted. Stem cell activity in the bone marrow reactivated. The patients didn't need donor blood. They just needed their own blood to be cleaned of the toxic byproduct of time. The long-term care industry, nursing homes and assisted living, is a real estate business model that relies on the slow, helpless decline of the elderly. Restoring independence to the elderly destroys this model. Furthermore, the health insurance industry realized that if this became a standard of care, they would be on the hook for keeping people alive and healthy for decades longer than their actuarial tables predicted. Insurance lobbyists worked quietly to ensure this procedure was classified as experimental and elective. They successfully lobbied to have it labeled a cosmetic enhancement, similar to plastic surgery, ensuring Medicare and insurance would never cover it. By keeping the price tag astronomical, they ensured it remained a niche luxury for the Silicon Valley elite, preventing the mass data collection needed to prove its efficacy to the world. 8. Neural plasticity restorers. The most terrifying aspect of aging is the loss of the self. Alzheimer's and dementia turn the brain into stone, unable to learn, unable to remember. This happens because the brain loses neural plasticity, the ability to grow new connections. Neuroscientists developed a class of small molecule drugs that inhibited the enzyme HDX2, which acts like a clamp on the brain's memory genes. By loosening this clamp, the drug restored the brain to a critical period state, a state of high plasticity usually seen only in childhood. In trials with mice bred to have Alzheimer's, the drug didn't just stop the memory loss, it brought the memories back. The structural atrophy of the neurons reversed. In limited human trials, patients regained the ability to learn new tasks and recall lost names. It was the closest thing to a limitless pill ever created. The Alzheimer's care market is projected to reach $1 trillion by 2050. The current standard of care involves drugs that merely manage symptoms or slightly delay the inevitable nursing home admission. A drug that restores function and independence eliminates the need for 24-hour care facilities and years of palliative drugs. The pivotal Phase 3 clinical trial was sabotaged by a strange redesign. The endpoints, the goals the drug had to meet, were changed mid-trial to focus on behavioral checklists rather than cognitive MRI scans. By moving the goalpost to subjective measures that fluctuate wildly in dementia patients, the statistical significance of the drug was diluted. It was declared a failure to meet primary endpoints, and the stock price of the biotech firm crashed, allowing the patent to be acquired and buried by a competitor focused on traditional symptom management. 9. The pan-immunity vaccine. Your immune system has a headquarters, an organ in your chest called the thymus. This is where T cells, the soldiers that kill cancer and viruses, are trained. As you age, the thymus turns into fat. It stops training soldiers. This is why old people die of the flu and cancer. Their army is gone. Immunologists created a pan-immunity protocol, a cocktail of growth hormones and specific peptides designed to regrow the thymus. It wasn't a vaccine for a specific bug. It was a factory reset for the entire immune system. In the Triumph trials, human volunteers actually saw their biological clocks reverse. Their thymus glands grew back. Their blood showed a massive surge in naive T cells, fresh soldiers ready to fight new threats. The risk of cancer and infectious disease in these subjects dropped precipitously. They had the immune resilience of 25-year-olds. A robust immune system is the ultimate enemy of the medical industry. A person with a youthful immune system naturally fights off the flu, COVID, pneumonia, and cancer. They don't need expensive antivirals, endless rounds of antibiotics, or chemotherapy. They just get better. The fear campaign here focused on autoimmunity. Industry-funded experts flooded the media with warnings that supercharging an old immune system would cause it to attack the body, leading to massive autoimmune diseases. Despite the trial data showing reduced systemic inflammation, the fear stuck. Regulatory bodies demanded impossible guarantees that the rejuvenated immune system would never make a mistake, creating a liability barrier that no insurance company would underwrite for a mass-market drug. 10. The metabolic stasis protocol. Perhaps the most radical technology of all was derived from studying hibernating animals like lemurs and bears. Scientists identified the neural trigger for torpor. This is a state of suspended animation, where metabolic processes slow to a crawl, and cellular damage stops completely. They developed a drug protocol that could safely induce this state in humans. Originally intended for stabilizing trauma victims on the battlefield or for long-duration spaceflight, Longevity researchers realized its true potential. If a human could hibernate for just a few weeks a year, or enter a deep restorative stasis, the wear and tear of living would be halted. You could essentially pause your aging process. In animal models, periodic stasis resulted in a doubling of the lifespan. The body used the downtime to perform deep cellular cleaning that is impossible while the organism is awake and active. It was a literal fountain of youth sleep. But the threat here was not just medical. It was societal and economic. The global economy is structured around a predictable human lifespan. Pension funds, social security, retirement ages, and life insurance policies are all calculated based on you dying at roughly 80. If people started living to 150 by pausing their lives, the entire financial structure of the world would collapse. The labor market would stagnate. The technology was deemed socially destabilizing. It was aggressively classified under national security provisions, with the argument that the technology had dual-use potential for creating super soldiers who could be stored in stasis until needed. By stamping it top secret, the government effectively removed it from the public sphere, locking the secret of stasis away in military black projects, possibly forever. The narrative you have just heard is a testament to a brutal reality. In the current medical-industrial complex, a healthy, long-lived population is a financial disaster. The technologies to extend human life, to alleviate suffering, and to cure rather than manage disease exist right now. They are not science fiction. They are science fact, locked away in patent vaults, buried under mountains of biased data, or strangled by regulatory red tape. We are being denied our birthright of health not because the science is too hard, but because the profits of sickness are too addictive. The gatekeepers of these technologies are betting that you will remain passive consumers of their symptom management drugs until the day you die a scheduled, profitable death. But knowledge is power. The first step to breaking this cycle is understanding that the limitations on your lifespan are no longer biological. They are economic. We must demand that research funding be stripped from corporate interests focused on profit and given to open-source scientific endeavors focused on cures. We must support the rogue scientists and the biohackers who are operating outside the system. The choice between a sickly 80 years and a vibrant 150 is real, but they won't give it to you. You have to fight for it. Share this video with everyone you know. Start the conversation. Demand answers. And if you haven't already, subscribe to this channel. We will continue to shine a light on the forbidden technologies that could change everything. The future is here. It's just being hidden.